Right now, at this very moment, your body may already be sending you warning signals about your blood sugar that have absolutely nothing to do with a blood test. Signals that are visible, that are there every single day, that most people walk right past without ever recognizing what they are looking at. And the most surprising part is that these signals do not appear in your chest or your stomach or your head. They appear in the place most people pay the least attention to, your feet. What if I told you that your feet may already be showing you 9 specific signs that your blood sugar has been elevated for months or possibly even years, and that recognizing just one of those signs today could genuinely change the entire direction of your health? I am Dr. Weston, and today we are going to talk about something that I believe every single adult over 60 needs to hear. 9 warning signs that your feet may already be showing you about your blood sugar right now. I'm going to explain what each sign looks like, what is actually happening inside your body when it appears, and what simple daily habit may help protect you. In 15 years of clinical practice, I have sat across from too many patients who had every one of these signs for months and had no idea what their body was trying to tell them. Today, I am making sure that does not happen to you. Before we go any further, I want you to drop a comment below right now and honestly tell me, when did you last take a proper close look at your feet? Just tell me how long ago. I read every single comment personally, and today that answer is more relevant than you might think. And if you have ever noticed any unusual tingling, numbness, or burning in your feet, please add the word yes to your comment right now. Now, let me start with something that most people have never been told and that changes everything about how you understand blood sugar warning signs. Your body starts signaling elevated blood sugar long before any laboratory result would catch it. The reason is that high blood sugar affects nerves and blood vessels gradually over time, and the nerves and blood vessels in your feet are the ones furthest from your heart and the most vulnerable to that gradual damage. They are at the end of the longest supply route in your entire body. They are the first to show the strain and the last to receive attention. And because the changes happen slowly, most people attribute what they notice to aging or tiredness or simply not wearing the right shoes. Today, I want you to look at your feet with completely different eyes. I have a patient I want to tell you about, a 69-year-old retired gentleman named Raymond, who came to see me last year for what he described as a routine checkup. Raymond felt fine, he was active, he ate reasonably well, and he had no dramatic symptoms to report. But when I asked him about his feet, he paused and said that they had felt a bit odd for a while, a bit numb on and off, a bit burny at night sometimes. He had been putting it down to being on his feet in the garden. When we ran his blood sugar tests, the results showed that Raymond had been living with significantly elevated blood sugar for what appeared to be at least 2 years without knowing it. He had 4 of the 9 signs I am going to share with you today, and every single one of them had been quietly visible for months. Raymond told me afterwards that he genuinely wished someone had shown him this list years earlier. Today, I am showing it to you. The first sign is something that almost every person over 60 has experienced, and almost every single one of them has explained away: tingling, numbness, or that pins and needles sensation in the feet. Most people tell me their foot just falls asleep sometimes, especially if they have been sitting cross-legged or in an awkward position. And yes, that happens to everyone occasionally, but when this tingling or numbness is happening regularly without a clear positional reason, that is a very different situation and one worth taking seriously. When blood sugar stays elevated over time, it can begin to affect the protective coating that surrounds your nerve fibers. Think of your nerves like electrical cables. Every cable has an insulating layer around it that allows the signal to travel cleanly from your brain to your foot and back again. When blood sugar remains high for extended periods, that insulating layer can gradually deteriorate. The signals start becoming unreliable, fuzzy. That fuzziness is what you feel as tingling or numbness. Some research suggests that this type of nerve involvement in the feet is among the most common early changes associated with long-term elevated blood sugar, and that it often begins years before a formal diagnosis is made. A daily 20 to 30-minute walk is one of the simplest and most consistently recommended habits for supporting circulation and nerve health in the feet. Movement encourages blood flow to the furthest points of your body, and that blood flow is exactly what your nerve tissue needs. The second sign is the one my patients describe as the most distressing because it does not hit them during the day when they are busy and distracted. It hits them at night when they are lying quietly in the dark trying to sleep. A burning sensation in the soles of the feet, not warmth, burning, as though the feet are pressed against something hot, even though nothing is touching them. What is happening here is that when nerve fibers have been affected by elevated blood sugar, they can begin sending incorrect signals to the brain. Your brain receives a message that says heat, even though no source of heat is present. The nerves are misfiring. Think of it like a fire alarm with a damaged sensor. The building is completely safe, but the alarm keeps going off because the sensor itself is no longer functioning correctly. The burning you feel is not coming from outside your body. It is coming from inside damaged nerve tissue that is sending false alarm signals. Some research has suggested that burning foot pain, particularly at night, may be one of the earlier reported symptoms in people later found to have blood sugar concerns, sometimes presenting a year or more before any formal diagnosis. Staying well hydrated throughout the day and including more fiber in your meals through vegetables, legumes, and oats are two practical daily habits that may support more stable blood sugar and better nerve tissue health over time. But wait, because what I'm about to share next is the sign that most consistently sends people to emergency care, and it is the one where catching it early makes the most dramatic difference. The third sign is a wound on the foot that simply will not heal. A small blister from a shoe, a minor cut, a tiny area of broken skin. Most people assume these things will close on their own within a few days because that is exactly what always happened before. But when blood sugar has been elevated for a sustained period, the body's ability to heal efficiently can become impaired. The tiny blood vessels in the feet gradually narrow and stiffen under the pressure of elevated blood sugar. This means that the oxygen, the white blood cells, and the nutrients that are responsible for repairing tissue cannot reach the wound site quickly or in adequate amounts. The wound sits open, it remains vulnerable, and an open wound that is not healing is an infection waiting to happen. Think of it like trying to water a garden through a hose that has a severe kink in it. The water is there, the pressure is there, but it simply cannot get through to where it needs to go. The healing ingredients exist in your bloodstream, but the delivery system is compromised. Tonight, after your bath or shower, sit down and carefully examine both feet. Look between every toe and at your heels. If you find any cut, blister, or area of broken skin, clean it gently with mild soap and water. Apply an antiseptic and cover it carefully. If it is not meaningfully improved within 48 hours, contact your doctor. Not next week. 48 hours. Pro tip number 1. Never examine your feet in poor lighting. One of the most consistent reasons people miss early foot wounds is simply that they check too quickly and in inadequate light. Use a hand mirror or ask a family member to help you check the soles and heels properly in good bright light. This takes 2 minutes and it genuinely matters. The fourth sign is hiding in plain sight every single day, and most people have never connected it to blood sugar at all. Discoloration of the skin around the ankles and lower feet. Patients point to areas that have become noticeably darker, more reddish, or in some cases with a slightly bluish tint, particularly around the ankle area. And the explanation is almost always the same. I have always had darker skin there. I think it might be sun damage, but there is a specific pattern of skin color change in the lower extremities that reflects inadequate circulation caused by blood vessel changes associated with elevated blood sugar. When the tiny blood vessels that supply the skin with fresh oxygenated blood become narrowed and less efficient, the skin responds visibly. It changes color as a distress signal. In some people, the skin in those areas also becomes thinner and more fragile, another sign that the tissue is not being nourished adequately. Think of your blood as a delivery fleet carrying oxygen and nutrients to every part of your body. Your feet are at the very end of the longest delivery route. When the roads narrow, the deliveries become unreliable. The skin, starved of consistent fresh supply, changes in appearance. Some research has suggested these visible skin changes may be detectable significantly before a formal blood sugar diagnosis is made. 5 minutes of ankle circles, toe raises, and calf stretches every morning may help encourage blood flow into those lower extremities, even on days when a longer walk is not possible. Tell me in the comments right now, have you ever noticed any unusual skin color changes around your ankles or feet that you could not fully explain? I genuinely want to know because your experience might encourage someone else watching to pay closer attention to something they have been dismissing. The fifth sign surprises almost everyone because it looks completely harmless, and most people have had it for so long they consider it completely normal. Severely cracked heels that do not respond properly to moisturizer no matter how consistently it is applied. Most people tell me it is just dry skin, and ordinary dry heels are indeed very common, but when the heels are cracking deeply and persistently, regardless of the season, and when no amount of cream or lotion seems to truly fix the problem, that is a meaningfully different situation. Your body has what are called autonomic nerves that control automatic functions you never consciously think about. One of those functions is regulating moisture levels and sweating in the skin. When these specific nerves are affected by elevated blood sugar over time, the sweat glands in the feet can gradually stop functioning properly. Your feet lose their natural internal moisture source. No lotion addresses that root cause because the problem is not on the surface of the skin. It is in the nerve signals controlling the skin from within. Think of your skin like a sealed wall where the mortar between the bricks is kept in place by an internal system. When that system is disrupted, the mortar begins to crumble and cracks appear in the wall. And those cracks in the skin of your feet are not just uncomfortable or cosmetic. They are potential entry points for bacteria in a foot where circulation may already be compromised. Moisturize your feet every single night before bed using a good lotion or pure coconut oil applied to the soles and heels thoroughly. And remember, never apply moisturizer between the toes, as trapped moisture in that area can encourage fungal growth. If this information is giving you important things to think about, I want you to hit the like button right now. It genuinely helps me reach more people who need this. And if you are not yet subscribed, please subscribe now and hit that notification bell so you never miss these conversations. Pro tip number 2, if you have been applying moisturizer to cracked heels for more than several weeks with no meaningful improvement, please mention this specifically to your doctor at your next visit. Persistent treatment-resistant cracking is worth discussing as part of a broader conversation about your nerve health and blood sugar status. It is a specific detail that your doctor needs to hear and that you deserve to have properly evaluated. The sixth sign is one that tells me something important, not just about the feet, but about what may be happening with the kidneys at the same time. Persistent swelling in the feet and ankles, particularly swelling that is present most days, and that leaves visible sock marks in the skin by evening. Occasional ankle swelling from long periods of standing or sitting is completely normal, but consistent daily swelling that keeps returning is worth paying careful attention to. When blood sugar has been elevated for an extended period, it can gradually affect kidney function. Your kidneys are responsible for managing the fluid balance in your body. When their filtering capacity becomes impaired, fluid can begin accumulating in the lowest part of the body under the influence of gravity, your feet and ankles. That accumulated fluid causes visible swelling, and when you press your finger into the swollen area, the indentation may remain for several seconds. When you rest, elevating your feet above the level of your heart even by just a few inches on a pillow helps encourage that accumulated fluid to move back toward the center of the body. Reducing sodium in your diet is also genuinely important here. Salt causes your body to retain additional fluid, which significantly worsens swelling. Reading food labels carefully and reducing canned and processed foods, which are typically very high in sodium, can make a meaningful practical difference. The seventh sign is the one I see most consistently misidentified and managed incorrectly for months or years before the real picture becomes clear. Sharp stabbing or electric shock type pain in the feet, particularly at night. Most of the time, patients tell me They have been taking over the counter pain relief for it, assuming it is arthritis or an old injury. And the pain relief does take the edge off, which confirms the assumption. But over-the-counter pain relief does not repair a nerve. When nerves have been affected by chronically elevated blood sugar, they do not always go quiet and numb. Sometimes they become hyperactive instead, firing intense random signals that the brain interprets as severe, sharp pain, even though no physical injury or pressure is causing it. Think of a damaged car alarm that goes off repeatedly for no reason. Nobody is breaking in. The alarm is simply malfunctioning. That is what a hyperactive, damaged nerve does. It sends urgent alarm signals continuously when there is nothing actually happening at the location of the pain. Masking that signal with pain relief without addressing the underlying cause means missing information your body is genuinely trying to communicate. Gentle foot and ankle stretching for 5 minutes every morning before getting out of bed, and a light circular massage of the soles and ankles each evening are habits that may help support circulation and nerve comfort in the feet over time. Pro tip number 3. Keep a simple written record for 2 weeks of when your foot pain occurs, what type of pain it is, and how long it lasts. This record is genuinely valuable information to bring to your doctor, because the pattern of nerve-related pain is often quite different from the pattern of joint or injury-related pain, and your description helps your doctor make a more accurate assessment of what may be happening. The 8th sign is one that many people laugh about when I mention it because they have been joking about it for years. Persistently cold feet. Cold regardless of the season. Cold even under heavy blankets. Cold in summer when the rest of the body feels comfortably warm. Most people tell me they have always had cold feet, and so has their mother and their grandmother, and it is simply the way they are made. And for some people that is genuinely true. But there is a specific quality of cold feet worth paying attention to. Cold that persists regardless of the environmental temperature around you, and cold that is noticeably worse than it used to be, are signals worth taking seriously. When blood sugar has been elevated for sustained periods, the blood vessels supplying the lower extremities can become progressively narrowed and less elastic. The result is that warm blood simply does not reach the feet in adequate volume. Think of your circulation as a heating system running pipes to every room in your body. When those pipes narrow, the room at the far end of the system stays cold, no matter how hard the furnace is working. The problem is not the furnace. The problem is the pipes. A purposeful 30-minute brisk walk every single day with arms moving actively is one of the most consistently beneficial habits you can build for supporting circulation into the feet and lower legs. If 30 minutes feels too much right now, start with 10. The most important thing is to begin today and build gradually. And now we have arrived at the 9th sign. This is the one that is almost never discussed anywhere, the one that does not appear in most health articles or patient information leaflets, the one that most people walk past completely without noticing because it requires knowing what absence looks like. Reduced or absent hair on the lower legs and the tops of the feet. I ask patients to look at their lower legs, and they often genuinely have not noticed this before. The hair that used to grow there has thinned significantly or stopped growing altogether. And when I point it out, the reaction is almost always the same. They look down and say they never noticed. That is precisely the problem. Hair follicles need a consistent, steady supply of blood and oxygen to function. When circulation to the lower extremities is significantly compromised, the follicles in those areas gradually stop receiving what they need to produce hair. Over time, they simply stop. The absence of hair growth in this area is a visible marker of blood vessel changes that in some cases have been progressing for years. Think of hair follicles like small plants at the end of an irrigation system. When the pipe narrows, the plants do not die immediately, they just gradually stop growing. That absence of growth is your body showing you something important about the health of your blood vessels in a place you can see every time you look at your legs. Some research has suggested that visible hair loss on the lower extremities may correlate meaningfully with vascular changes associated with elevated blood sugar and represents a sign that physicians are specifically trained to look for during foot examinations. After this video, please take a moment to look at your lower legs and the tops of your feet. If the hair is noticeably thinner there than elsewhere on your legs or absent entirely, please schedule a blood sugar check with your doctor this week, not this month, this week. Let me now bring everything together for you with a clear action plan you can begin today. Tonight, before you go to bed, spend 2 minutes examining your feet properly in good light. Look at the skin color, check for any wounds, feel for areas of numbness, and look at the hair on your lower legs. Notice what you see and write it down if anything concerns you. Start a daily 20 to 30-minute walk if you are not already doing this. Movement is one of the most consistently beneficial habits for blood sugar management and foot circulation. Increase your daily water intake and add more fiber to your meals through vegetables, legumes, and whole grains. Moisturize your feet every night. Reduce sodium in your diet to support healthy fluid balance. And if you recognize any of the 9 signs we discussed today, please bring them up specifically with your doctor at your very next appointment. Do not wait for your next scheduled checkup if something concerns you. Make the call. You have worked hard for the health and independence you have. You deserve to have the information that allows you to protect it. Your feet have been carrying you forward every single day of your life. They deserve 2 minutes of careful attention tonight. In my next video, I am going to talk about 5 specific foods that some research suggests may actively support healthy blood sugar levels and nerve health in adults over 60. You are not going to want to miss that one, so please make sure you are subscribed and have your notification bell turned on. If this video gave you something valuable today, please share it with someone you care about. A family member, a close friend, someone who might be walking around right now with signs they have never known to look for. That share could genuinely matter more than you know. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to the channel and hit the notification bell so you never miss a health tip. See you in the next video.